Welcome to Osce Academy. I'm Brian Mouse, and today we begin our journey by understanding what Osces are, how they are structured, how much time you get, the different types of stations, and how your performance is scored. Let's dive in. An Osce is an objective structured clinical examination. Objective structured clinical examination. It's a practical exam where you demonstrate your clinical skills in a controlled and timed environment. So you move through a series of stations, each testing a specific skill or scenario designed to mimic the real-world situation. Each OSC circuit typically has 5 to 12 stations, and you are given 5 to 10 minutes per station. Outside each room, you will find clear instructions. Read them carefully before you enter. Inside, you may interact with a patient's actor, use a model or a complete written task. Timing is crucial. Usually, get a minute or two to read the instructions before starting. Then you perform the task in 5 to 10 minutes. A bell or a buzzer signals when to start and stop. If you don't finish, move on. Train yourself to work within these limits. There are several types of OSCE stations. The most common include history taking, physical exams, and communication skills. Others may test your ability to interpret data, perform procedures, or counsel a patient. Knowing what to expect helps you prepare strategically. Scoring is objective. Examiners use a checklist to mark each task you perform. They assess how well you follow clinical steps, communicate, and manage time. Some stations also include a global score reflecting overall performance. Every mark counts, so be precise. To succeed in OSCEs, practice often, simulate stations with friends, time yourself, and seek feedback. Focus on communication and stay calm even under pressure. Know the station format and always act professionally. You are being tested as a future clinical or healthy worker. Let's now walk through a sample station. A 40-year-old man presents with chest pain. Your task is to take a focused history in 5 minutes. What would you ask first? Let's simulate it. Begin with a greeting, then explore the presenting complaints using Socrates, which is site, onset, character, radiation, associated symptoms, timing, exacerbating and relieving factors, and severity. Ask relevant past medical history, drug history, lifestyle, and family history. Conclude with a summary and a plan. Now take a moment to reflect. What challenged you in that sample task? Did you run out of time? Were your questions relevant? Use this reflection to improve your next practice. To wrap up, OSCs are structured, objective, and intense. But with practice, you master them. This week, start practicing simple stations at home. In our next session, we will look at mastering history taking. Stay consistent and you gain confidence fast. This is Brian Mouse.